so here are my quick thoughts on plantar fasciitis. So plantar fasciitis, what is that? Essentially, we have our fascia. We have this thick, tendinous and muscular kind of tissues on the bottom of our foot. So the plantar fascia, it pretty much connects from the bottom of our toes and goes towards the heel. And this is a very thick, very strong fascial tissue. So plantar fasciitis is essentially just swelling of that plantar fascia, or like inflammation of that plantar fascia. The thing about plantar fasciitis is it's a label, it's a diagnosis, but what is actually causing it? So there's a couple different perspectives to look at here. There is the perspective of plantar fasciosis as well. So this is kind of the fact that there's this adductor muscle, adductor foot muscle here that runs along, connects to the bottom of our big toe and connects to the heel. So essentially, if we are actually lengthening that muscle, or if it's being kind of tensioned through the shoes that we wear, where we're squeezing all of our toes together, kind of like this, squeezing everything in and lengthening that muscle, plantar fasciosis can occur where we're actually cutting off blood supply. Tissues and cells of the plantar fascia that have now degraded or died off because of this lack of blood supply. Now, again, this plantar fasciitis inflammation could be occurring because of fasciosis, or like lack of blood supply and cell death. This inflammation could also be occurring because of overloading of these tissues as well. So if you're a runner, or if you're some kind of athlete who's doing a lot of jumping or a lot of activities on their feet, which is pretty much any athlete, or even if you're somebody who's hiking a lot or just getting a lot of mileage in on your feet, then we can also overload these tissues, and if these tissues are now chronically overloading and they're not getting a chance to heal, then this inflammation can linger around as well. And the inflammation is also going to linger around, and that's going to be compounded by the fact that you're not getting adequate blood supply as well. So this clearing of inflammation can also go hand in hand with a lack of blood supply, or a lack of venous return, or a lack of lymphatic drainage. But another perspective is that the thing that we actually feel pain through is our nerves. So for us, we have the tibial nerve that runs and courses through this medial aspect of our heel and ankle, and runs into the bottom and supplies the bottom of our heel, usually where people feel a lot of that plantar fascia pain. So the other thing that could be happening is that these nerves are not getting adequate blood supply, or these nerves are being a little bit more tensioned. So that could be because of restrictions, soft tissue restrictions and mobility restrictions at the ankle, is putting a little bit more pressure on these sensitive nerves. And nerves can become sensitized from old injuries, they can become sensitized from overloading of tissues. But the idea here is that even if we're feeling this pain, our nerves are involved, because that's what we feel the pain through. So targeting these nerves by getting adequate blood supply to them is also going to be a function of recovering from this plantar fascia pain. So it's a combination of factors of, your plantar fascia is inflamed, or you have this inflammation going on there. Why is it inflamed? Well, inadequate blood supply and inadequate environment for the nerves to function optimally as well. So priorities for recovery, in my perspective at least, are going to be to focus on getting blood supply to these nerves that run kind of medially and posteriorly along the lower leg. So think more soleus rather than gastroc, or like tibialis posterior exercises, things that are going to help with just like stability of the lower ankle are going to be important. And then the other thing that I would say is important is working these muscles that run along the foot as well. So making sure that you're doing different toe movements, or you're doing balancing exercises that force you to engage these lower foot muscles are going to be a priority as well. So really a combination of factors that can play a role in what causes this plantar fascia pain, whether you call it plantar fasciitis, whether you call it plantar fasciosis, or whether it's kind of a nerve sensitization. We want to make sure that we're getting adequate recovery from the activities that we're doing. We're still loading these tissues in order to promote better tissue health and blood flow to the nerves and the whole tissue system down there at the ankle as well. So another point just to add is that we have our nerves as a system, we have our muscle systems, but I also want to talk about like the joint systems in the foot and ankle as well, because if we think about our plantar fascia pain here, the joints above and below are going to be an important factor to making sure that those muscles and those tissues are not being overloaded. And the way that they're not going to be overloaded is by sharing and distributing forces appropriately through the joint systems, like I said, above and below those muscles. So we really want to take a look, even with plantar fascia, at how this big first joint, this big toe first joint is moving as well. I'd say this big first toe joint, and then this small one out to the side too. So do we have adequate dorsiflexion through these joints? And do we have adequate plantar flexion through these joints as well? So that's a big thing to address. And even abduction, I would say too, right? So abduction here. And addressing these is going to be important, like I said, just to make sure that load is being shared appropriately through these toes and through the foot as well. Because if these muscles, we have two big muscles along the outer sides of our foot that can help share load with the plantar fascia as well. So just making sure that those are strong and being used throughout your movements is going to be very helpful. The next thing here to focus on is, do we have adequate dorsiflexion and plantar flexion through the ankle? Because if not, again, that load is just not going to be shared very appropriately through the muscles of the ankle as well, or the muscles above the ankle. So now these muscles above the ankle are not functioning to coordinate with the muscles that supply the plantar fascia as well. So if we're lacking dorsiflexion in the ankle and we're not able to utilize these muscles, then that's going to be something to address as well. All right, so thinking about the joints above and below where you're feeling pain is going to be helpful. Addressing the muscles around the nerves are going to be helpful, and restoring all these soft tissue systems to relieve tension or sensitization along these nerves is going to be helpful in making sure that they're getting appropriate blood flow and nutrition as well to clear out that inflammation, to provide tissues with adequate nutrition they need to recover and get stronger and to function optimally. All right, that's it. If you have any questions, feel free to leave a comment down below. I'd like to talk more into it. But yeah, if you like the video, I'd really appreciate a subscribe, or even just a like, whatever works for you. This is really just me trying to share my thoughts, share my opinions in hopes of helping you guys recover out there and just sharing some information and starting the discussion around these topics. So thank you very much for watching, and I'll see you in the next video.